Okay, hi, I'm Arnav. I work at Evolving Web. José Morais is a very special person to me. I've worked with him twice. So,
turn this way.
Yeah, so José is he's the physician in charge of geriatric medicine at McGill and all their associated hospitals. And so in a previous life, I used to raise donor money for him to do all the wonderful programs, including the one he's talking about today. And then when I came to Evolving Web, he said, well, I need you to make this website for me using the money that you raised in the previous job. So I think he's a happy customer twice. So I'm very happy you could come here today, José, and talk about Safe Seniors.
Thank you, Arnav. I'm not a businessman, but I can take profit from my relationships. So I'm very pleased to be here. It gives me a very good excuse to leave the hospital in this Friday bright, sunny afternoon to talk to you about SAFE, a project that was and is still very near to me because it has to do with directly with my practice. Okay. SAFE stands for let me see if I can remember, Senior Adult Fitness Exercise. You know, in my practice, I do see a lot of people that falls with consequences because some of the falls lead to fractures and admissions to the hospital, surgeries, and about a third of them end up requiring to be placed in long-term care. So how can I prevent this from happening? And we know that one of the causes of falls as one ages is because we become very sedentary. You know, we don't move enough. Some people, in fact, feel that because falls happen when they move, they should restrict their walking. But then as, you know, negative feedback on their health. And I don't bother you with statistics. Oh, by the way, I have no expertise on website design, so you have to bear with me. But very simply, this is a graph to show that as one ages, and men more than women, there is increased fall rates. Okay, and to the point that falls is a major public health issue. You know, in Quebec, for example, there is about 20,000, a bit more than 20,000 admissions or visits to emergency room per year. So if you could decrease that number of visits to emergency room, you would alleviate the pressure that there is in our healthcare system. And falls is about 25% from all responsible from all the visits to emergency room. So if we prevent falls, we can have a tremendous impact, not only on the healthcare system, but also on the quality of life of people. So I go over very quickly about these consequences of falls with hip fractures, many bone fractures, contusions, commotions, and all the rest. And it comes with a cost. This is data from 2014, almost 10 years ago. Time flies. But already was calculated at that time that it costs about $2 billion per year in Canada to deal with falls and its consequences. I don't have more recent data on costs. And what I know is that the most efficient intervention to prevent falls is exercise. And here I'm just presenting to you a study, meta-analysis but more than 1,000 studies, because there's a lot of literature on falls, how to prevent, etc., etc. And it clearly showed, this is very great reputation, the Cochrane Library, and in their studies, meta-analysis, 34% of falls can be prevented with exercise. So this led me to create a program of exercise to prevent falls, and is the purpose of the SAFE. So I wanted it to be accessible, and a website gives access, especially if it's there and it is free. And I wanted it also to be a program in which one can go through different levels of exercise as one improves. Because it's clear that you can improve with exercise, but if you stop doing it, you're going to lose whatever the gains are. So this being the case, the program was constructed to have different levels of difficulty. and also to have different categories of exercise, because it's known that for health in general, and particularly for falls prevention, you need to deal with at least 4 categories of exercise that comprises not only strength, but balance and coordination as well, flexibility of the joints, and also endurance that helps one to do more longer distance with less effort. Because whenever there's an effort, human beings don't want to do anything. So it's not only older persons that don't exercise, at our age the same, because it requires an effort. We have to exercise, activity should be part of our daily lives, we have to adopt that habit, and only after that it becomes easier for us. So we create this program with the intention of improving quality of life and also prevent falls. And we wanted something free, that people can do it from home instead of going to a gym or outside, especially for that population that falls frequently. These are frail older persons, and going outdoors is in fact a risk, so they can do it from their own homes. I already mentioned about the 4 levels of difficulty, or 4 different levels of difficulty, and the different types of category of exercise. And I have to say that these exercises were selected based on our own experience, because I run a day hospital with rehabilitation, and I have published on the success of these programs. So the exercises were selected based on evidence, as opposed to just because I love exercise, I propose them to do. And already I mentioned about all of it. Plus, you know, if you are more physically active, you have a better quality of life, because you can do more things, you're more autonomous, more functional, especially as you advance to very, you know, old age, above 85, 90. So our aims is to have exercise accessible and easy to use from home. The way these exercises are presented, they are in video of about 15 minutes each, and with the different categories, with the different levels of difficulty. So a person can select those they feel that they have to improve. They can stop at any time, rest, and come back later. So it becomes very personalized, very adaptable to their needs, and with a lot of, I would say, physical as well as psychological benefits, because exercise is good for health in general. And I'm trying to convince government that is a work promoting program. So I'm working with Minister for the older adults in Quebec to have this encouraged, supported by the home care services, for example. So this is French or English? I think it's French, but there is warm up, strength, balance, flexibility, and endurance. Each of them have their own purpose to make a program that would improve general health and well-being and performances as well. And there is also other pages on the website with information, general information on health, good habits that one could adopt, some frequent questions and answers, and then there is the videos. The videos, they can select, again, with the levels and the type of exercise, and adapt it to their needs. I have had great feedback. The website is designed in such a way that is appealing to them. The colors, the brightness, the wording, the size of the letters, etc. And this is a collaboration between my team, Evolving Web. I had no expertise on the web design, but the content is valid, and both French and English, and it's free for your parents. You're still too young. So thank you for your attention. I'm available for questions if there is any.
Merci. Des questions pour le Dr. Morais?
Question rapide ici.
How difficult was it to tailor a site specifically to an elderly population who maybe is not as used to navigating websites?
There is a limitation there, and we are aware and cognizant of it. And in fact, all of our promotion and let's say marketing, though it's a free thing, there is no gain or profit here, is focusing, because they are very frail, these people. So it's focusing on the help and assistance coming from caregivers. You know, they are frail, and there is always some neighbors, some family member, kids, or a spouse. So we put a lot of emphasis on the caregivers assisting the older persons to adhere to the exercise. In fact, I've received great feedback. Reason being that sometimes the caregiver doesn't know what to do with the old person, you know. And doing the exercise becomes an activity in which they exchange, there is more interactions, and becomes a source of improving the relationship, etc. So it's very good. What I'm trying to do now is working with home care service. So those older persons that are homebound, these are the ones who fall the most. You don't need to go to Saint-Denis Street to fall. You fall at home because they are so frail. So those who receive home care service, and they receive help to get dressed, to get washed, etc. So we are working with the community service to have these, they have volunteers, not really volunteers, but these people, we call them in our hospital, the jargon is PABs, you know, these patient attendants, you know. So to encourage them and support them in following the exercise program. Yeah.
I think unfortunately we don't have time for more questions, but Dr. Morais will be available to you. Thank you very much.
I'll be here for the next 15 minutes. Consultations are free. Okay, thank you.